author Winslow E. Dixon here, and I'm doing this video to show you my newest book, Managing Medullary Sponge Kidney, A Patient's Guide to Managing MSK. So this is what the book looks like. It's, of course, says Manage Medullary Sponge Kidney, and I'm just going to go through the PDF on the computer to do a screen share to show you what it's all about. So this is what the book looks like on Amazon. It is available in Kindle and paperback, and I just wanted to show you a little bit about what it involves, and hopefully it will help some of you manage your medullary sponge kidney. So here's a table of contents. Starts out with what is MSK, symptoms and diagnostics. There's a survey, also some information from Dr. Goldfarb, who is a nephrologist at NYU. It also talks about medications, alternative options, supplements, finding a good doctor, the different types of kidney stones, testing and evaluation, emergency room visit suggestions, whole chapter on kidney stents, urinary tract infections, treatment concerns, sepsis, antibiotics. There's a chapter on dietary triggers, low oxalate protocol, hydronephrosis, which is basically swelling in the kidneys. There's a chapter on pH balance, which actually does affect kidney stone formation and function. There's a chapter on citric acid, life with medullary sponge kidney, mental health, which we know is very important with chronic illness, advice for caregivers, and also some information about some help that you guys can get. So this is just an overview of the book. Like I said, it's pretty much everything that I wish someone had told me when I was diagnosed. And there's also information from the survey that some of you guys took part in on the Medullary Sponge Kidney Facebook group. So thank you for that. It was really informational. I'll zoom it in a little bit here, but it talks about a lot of conversations that I'm sure you guys have had with physicians, and it very much validates the story that MSK is not always a benign condition. So there's questions like, when did you start having MSK symptoms? What age were you diagnosed? How many kidney stones do you form per year? You know, things like that. Do you normally pass kidney stones? Have you ever had a stent? How many stents have you had? Have you ever had lithotripsy? How many procedures? Talks about kidney gravel, which is interesting because there's these tiny little kidney stone-like grains that is pretty common with some forms of MSK. So I thought that was very interesting that 86% of you guys talked about this, because I have had it as long as I've had this condition, and I've never really heard a physician or a nephrologist be able to validate that. So you guys validated that for sure. It talks about how many urinary tract infections you get per year, how many times you visit the emergency department. And this was interesting as well. Do you have pain associated with your MSK? Almost every person that took the survey said that they did. So this very much validates that it is not a benign condition like we've been taught. So there's a bunch of, like I said, survey questions and graphs that I thought were very important. Additionally, like I said, there is some commentary from Dr. Goldfarb, who is a nephrologist and the clinical chief of nephrology at NYU Harbor Hospital. And it does contain a copy of his letter, which is both his form of it, and then it's typed so that it can be read easily. I thought this was really important to add, because if you're ever in an emergent situation or something like that where the physicians don't exactly understand the nuances of MSK, this very much validates every symptom that we have and explains things. And it's a little bit more well received when it comes from another physician. Just physician to physician, they tend to listen a little bit more. So I thought that was very important to add. And like I said, there's other things mentioned in this book, you know, medications for MSK. Just a disclaimer, don't start or stop any medications, supplements, or treatments without first consulting your physician. This information is just information. I am not an MD. I am a naturopath and do run a clinic, but I am not a licensed medical doctor and do not give medical care or advice. This is basically just an informational book that talks about different things that you can do to manage your MSK. So I wanted to make sure that I included everything that I wish I was told when I was first diagnosed. So like I said, this is what it looks like on Amazon. It is free on Kindle Unlimited. And I don't know how much you guys know about the Amazon thing, but I don't get a full $25. And I didn't write this book for money, and I didn't write it for whatever. And this is not self-promotion. I wrote this book because I, like many of you, have been in some situations where the physicians really didn't understand the seriousness and the nuances of having medullary sponge kidney. Chronic kidney stones and chronic pain and things are very detrimental to your health status, specifically your endocrine system and your adrenals. And so when you have unmanaged pain, unmanaged symptoms, it can really be derogatory to your health. So I wrote this book because I wanted to validate every story that I had heard. I also wanted to really make sure that we had a voice. People with MSK struggle a lot, not only with health, but also the mental implications that come with having a chronic illness. So I definitely wanted to add that into the book. And then the part with the caregivers, I did take the survey questions and I wrote down basically everything that had been told about what they wish people knew about MSK. Like we said, MSK is a very, very daunting illness, not to be negative, but it's a heavy load to bear sometimes. So in the chapter for advice for caregivers, I did include a couple things about how they can best support you. These are some responses. Understand that we are in pain and we might have to cancel plans, and also educate yourself on the condition. Offer to assist with chores, childcare, etc. Educate yourself. Help me get to appointments. Understand when I have to cancel plans. There's a lot of responses here that I feel like if you do have a loved one that has a chronic illness, it's very important to know, because if you've not had health issues, you don't exactly know how to react to it. And so this chapter was very important to me so that there would be understanding. And I do hope that it kind of helps family members, caregivers, and, whoever else that might want to know how to assist someone with medullary sponge kidney. So that was a very important chapter. Like I said, there's also, ways to support and things like that. So this is Managed Medullary Sponge Kidney. It is available on Amazon and Barnes and Noble. I'm working on trying to get it into an ebook format. Hopefully that will happen within the next couple weeks. But again, my name is Winslow E. Dixon. I am an author. I run a holistic health clinic, and we offer the Managed Medullary Sponge Kidney program through our clinic. So if you want to check that out, like I said, I have the condition myself. I do naturopathic and holistic medicine, and that is basically how I survive and I live, and not anything against modern medicine, because I believe in that too. It's just sometimes you have to have every resource, and I believe that we need to treat the mind, the body, and the spirit. So that being said, thank you for watching this, and I hope that your MSK is managed. And if you need, some support or whatever, please don't hesitate to reach out. And I wish you well, wishing you hope, healing, and happiness.